The cerebral hemispheres represent the highest integration of neuronal function. The neuronal activity of the hemispheres is incredibly complex. So whatever system that we use to examine the cerebral hemispheres will be oversimplified and perhaps artificially compartmentalized. On the other hand, the mental status examination does give us the opportunity to look at the various parts or lobes or functional areas of the cerebral hemispheres. So the rest of this anatomical section of the tutorial will look at the various sections or areas of the cerebral hemispheres and how we examine those areas with the mental status examination. Frontal lobes. The frontal lobes are important for attention, executive function, motivation, and behavior. Tests for frontal lobe function include working memory, judgment, fund of knowledge, task organization, and set generation, such as a naming list of things in a certain category. Temporal lobes. The temporal lobes are important for emotional response, the amygdala and its connections to the hypothalamus and frontal lobes, and memory, the hippocampus and limbic connections. Clinically, the main tests for temporal lobe function are those of memory, particularly declarative memory, language, temporal and frontal lobes. The principal area for receptive language is Wernicke's area, which is located in the posterior part of the superior temporal gyrus of the dominant temporal lobe. The major region for expressive language is Broca's area, which is located in the posterior part of the inferior frontal gyrus of the dominant hemisphere. Homologous regions of the non-dominant hemisphere are important for the non-verbal, contextual, and emotional aspects, as well as the prosody or the rhythm of language. Tests for written and spoken, receptive, and expressive language are used to view these language centers. Parietal lobes. The parietal lobes are important for perception and interpretation of sensory information, especially somatosensory information. The non-dominant parietal lobe is particularly important for visual spatial function. The dominant parietal lobe is important for praxis, which is the formation of the idea of a complex purposeful motor act, while the frontal lobes are important for the execution of the act. The Gertzmann syndrome, which consists of a constellation of findings including acalculia, finger agnosia, right-left confusion, and agraphia, occurs with damage to the dominant inferior portion of the parietal lobe. Clinical tests for parietal lobe function include tests for agnosia, which is the inability to identify objects by tactile exploration, apraxia, which is the inability to perform purposeful motor acts on command, constructional apraxia, the inability to draw objects which require use of visual spatial organization, and testing for elements of Gertzmann syndrome. Occipital lobes. The occipital lobes are important for perception of visual information. Areas in the inferior temporal visual association cortex are important for recognition of color and shape, as well as recognition of faces. Projections from the occipital lobe to the superior temporal parietal area are important for perceiving motion of objects. Tests that are used to examine the occipital lobes and their connections include visual fields, naming of objects, naming of colors, and recognition of faces. Traps. 1. There is more variability to the expression of lesions of the cerebral cortex than of structures that are more caudal on the neural axis. Number 2. The time of day, stress, fatigue, and pain can affect a patient's performance on the mental status examination. Number 3. You need to consider the patient's social and educational background when evaluating the results of the mental status exam. Pearls. Number 1. The mental status exam begins with listening and watching the patient during the history part of the examination. Number 2. The patient must be awake and alert in order to have a window to view the cortex. So assessment of the level of alertness and the intactness of the reticular activating system is actually the first step in the mental status assessment.